Okay, hello. How you doing?
Hey, doing all right. How are you?
Surviving, I guess.
That's the story of all
So
for all
I
of us these
know,
days,
I
I
know. It's
think.
like,
Yeah.
oh my goodness, I don't even know what day it is, or month,
Uh,
or year. I do know what year it is. That's for sure.
oh, that's good. That's good.
Yeah,
You'd pass that orientation
yeah. I
times
think
four.
everybody knows what year it is right now.
So
um,
what do we got today?
I don't know. I think maybe I've talked with a lot of people lately, and I know you just had a conversation with a therapist about waiting lists.
Oh, yeah. So we were, just in the clinic, kind of, the normal meet you in the hallway stuff. And they were talking about how we have this client who has been, reaching out to our clinic for services. And they've been on the waiting list at another clinic for 6 months.
Oh my gosh! Wow!
I know. And it kind of
Wow!
blew my mind because
Yeah.
I guess that we learn, being in practice for almost private practice for almost 15 years now, we've learned a lot about those waiting lists.
Yeah.
And
Yeah.
so I was trying to give our, our therapist, our team member, an idea of why we decided what we did. And I think you've had conversations with outside
Hmm. Yeah.
um,
Yeah. Other
providers
managers
about the
and
same
yeah.
thing.
Yeah.
Just, what are those things that you have to consider from the inside, like internally from the office? And then,
Yeah.
and, we always need to be thinking about that family centered piece
Yeah.
of it too,
Yeah.
that waiting for 6 months, I can't
Yeah. Yeah.
imagine,
Yeah.
is it
Yeah.
appropriate? So what do you think about that from like the office standpoint? I'm wanting to know if you thought like me in this.
Yeah, I mean, like I think, like I kind of going back thinking about where we started, because like you said, we've been 15 years, and we started you having a waiting list.
Oh
I
yeah.
remember
Hmm.
that, and what we found is we got frustrated with it. So we'd have a waiting list that was kind of like infinity almost, like people just
Exactly.
and then what happened was we had this, and so it was taking up all this space on our EMR and our computers, and then it looked like we would have all these clients ready to go. So it kind of gave
Right.
us as a clinic a false idea of the referrals. So we would hire somebody, and then we went back to the waiting list, and it was okay, well, only maybe a fourth of them still need services.
But we had spent all of our
But we'd
time
spent
going through
all
that
that time.
entire list again. Yes.
Yes. So it took a lot of staff time, and it wasn't super reliable. By the
Mhm.
time there was an opening, then a lot of the families didn't still need service, or they
Mhm.
moved, they had a different number, and we had no way of contacting them.
Right.
We also questioned, is it ethical for us to have a waiting list, especially in the area that we are in, where there's other companies and therapists that can provide, a similar service.
Right.
So we kind of battled, like, ethically, we should be, as ethical providers, when we can't provide services, we should be sending them out and giving them information for other organ or for other
Right.
agencies that would meet their need. Now I know there's some specialty services where that's not the case. Like I think about
Mhm.
my son, and he needed to get into endocrinologist. Well, it was like
Mhm.
6 months, right? But I didn't have anywhere else
Right.
to go. And so they
Right.
just said they don't keep a waiting list either. They just say, call back every day. And if you call back there, and if you want, or however often you want, and
Right.
if there's an opening that day, we'll get them in. If not, your appointment's in 6 months, because that's the
Yeah.
earliest we have. But I didn't have, I didn't have much of a different choice, because that's just, wasn't any
Right.
emergency.
It's
It
more of
was,
that specialized service, but I
yes.
agree with you. So many of us in this, in this area, in this profession, we're trained to do very similar jobs. So I
Mm-hmm.
think for the most part, it doesn't hurt to go and refer and give choices to
Mm-hmm.
clients, to not just sit and wait. I think that, when I think about that, like I was saying, from the family perspective too, that if somebody says, okay, I'm going to put you on my waiting list, I might think, okay, I'm done. I don't have to do anything else.
Yeah.
I can put this
Yeah.
away, and not know that 6 months could go by. And like you're talking ethically, especially you and I working in the pediatric world, 6 months, that's huge
Big deal.
to miss
Big
out
deal.
on services,
And especially I see that in families, like when they get a referral for a specific company, and they say, no, I need to get services from this company. That company, if they can't provide services right away, they need to be honest with families and say, we can't, but here's other places that can do something like what we do, because I think that there's that false sense of hope, that if they just wait a little bit longer and things change, I mean, we might tell them, in the past, oh, well, we can get you in 3 months, and then we have a therapist quit, and then it's another 3 months. And so doesn't seem ethical either.
Yeah, it doesn't seem really
and I think too,
sure.
like for the patient, like it makes them, that kind of prevents them from contacting other places. I'm sure it would be very frustrating on the family side, the patient side,
and I think that we did that initially because, it seems common practice to have a waiting list, I think we're kind of outsiders now in the fact that we don't. And whenever I talk to new private practice owners, or maybe even those that don't have to abide by the code of ethics as a therapist, so maybe more of like a business person model, they seem to act with those wait lists kind of out of fear of like, I've got to hold on to all of these people because I don't know what's next. And I think that's just, it's kind of a myth. And I think it's better to get over it sooner rather than later because there's just more than enough to go around for all of these providers. If anything, we're facing a shortage of providers versus a shortage of clientele, so I think it's just kind of understanding that as a business owner, that's not really the case,
Yeah.
Other thing, what are some other things that we've done, to make that work to where we do have openings,
Yeah. Well, so, I was thinking that whenever we decided not to have a waiting list, like you were saying, we were kind of scared. But then once we did it, it was kind of freeing, like we weren't holding on to the guilt of all these families waiting on us, and the referrals kept coming. And it just, it just kind of worked out. It seemed to work out for both parties. But what we did was we just came up with a schedule. And so this might be different for different clinics. But for us, we use Google Calendar. Not for patients, but for availability for therapists. So we have therapists go in and we created a Google Calendar for each different treatment room. And we also had them put availability, like if they have Wednesdays from 3 to 5, they put that on the speech availability. So whoever's doing our referrals can go see that to see who has availability.
And I was talking to our clinical manager about that the other day, and she was saying that, she's starting to coach the newer people and the clinical fellows on like filling that out in anticipation of discharge and stuff. So if you know that you're going to be discharging a client in 3-6 weeks, going ahead and putting it out on the calendar that availability for that session is coming up, not only so that referral manager can know, like what's coming up to be open, but that therapist is not going to have that void for very long. So I think that's important too.
So we used to get Google Calendar, and then we set a timeline, and we said, if we can't schedule new clients within this time frame, and we used a month, like 30 days, then we told the client, we can't get you in these 30 days. So here's a list of other places to call. After, this point, call us back again if you haven't found services, and we'll see if we have any openings. Kind of like the doctor did with me and my son. And that put the power back into the hands of the family. And it also, gave them that false sense of hope that they were going to get in. We can't promise any of that. And so, and then, we did more of a, so then they, within 30 days, and then it was kind of a first come, first serve back on there. And so those were some things that we did. And it's helped. I mean, I'm sure it has. I mean, it's just made things much more manageable, and like you don't have that feeling of guilt, like you aren't meeting the needs of everybody. And then it also goes back to it's the ethical thing to do, and it's family centered. So it really empowers families to advocate for their child's needs by seeking out other services, and then or coming back to us after a certain amount of time. So
I agree. I think
it's hard. It was a big jump for us. I was so hesitant.
I remember it, but it's been so long ago now that I cannot imagine going back to it. You know,
managing all the lists and the numbers and
the phone tag that would happen and all of that. You were just spending so much of your time, coordinating just to get in contact with people rather than to know were they still interested, had they found what they needed, those things. And I can't imagine going back.
I would guess that our return rate was like 25%.
I would say
on the waiting list.
Mostly if they had waited longer than what we're
than the 30 days or whatever.
Like if we were if they were waiting more than 30 days to get an appointment for us to call them back and get them scheduled, it was, like you said, it was 25% or less.
Yeah,
for sure.
Yeah.
So our business has continued to grow. So I don't think that it's impacted us to not have a waiting list.
Yeah. Because if you're not careful as a clinic, it can create a bad image for you. If you, parents will start getting frustrated. They'll start telling other people, well, I'm on a 6-month waiting list. And so it can create a bad image for your clinic too, if you're not more transparent with families and say, this is what the status is, and this is when you can call back. And,
and with what we realized is it was frustrating some of our referral sources too, when we had longer wait lists and they would stop sending referrals because they knew that their clients were waiting so long. So it was kind of backfiring, like you said, and causing that bad image. So I think there's just a lot more to consider than, are we always going to have the referrals? There's just so many other factors.
Well, once again, great discussion. Yeah. And you have a good day.
All right. You too.
Bye.
Bye.